Welcome, my friends,
Thank
to
you very
Dental
much.
First Aid Plus Training. 1 Timothy 2:2 principle, replication. All right, this is first aid, and I'll define what all that means, and plus is something that goes along with that in addition. And in 2 Timothy 2:2, the Apostle Paul said, "And the things that you have heard from me among many witnesses, commit these to faithful people who will be able
Yes.
to teach, to train others also."
Good. Good.
Now, let us move on to the other section.
Thank you.
Okay, these are our dental tools, our setup, and in order to make this first aid training replicable,
Okay.
okay, it has to be, first of all, it has to be simple, safe,
Okay.
effective, and economical.
Okay.
And simple and safe are critical. And in order for it to be safe, we have built-in infection control guidelines. So that way, if you can learn how to follow the steps according to the way the system is set up,
Okay.
then you will not violate infection control principles and other safety elements, so that it's essential that when we provide dental care to whoever and wherever, that it's done safely.
Yes.
Safely is critical. And if you notice, we have what we call a 2-cup system. All right? Now, you can set up the tray in multiple ways. This is simply an 88 cents cutting board you can buy at Walmart.
Okay.
88 cents. Can you afford it?
Yes.
88 cents.
Yeah.
This is your whole setup. It's based on this simple tray. You have a 2-cup system, and you notice you have a little red barrier wrap. Here's our tools over here. You'll notice these little red barrier wraps. Barrier wraps are so that you don't put your hands in the mouth. Then the barrier wrap is where you always hold your tools on the other side of the red barrier wrap. Tool. Okay? So after the procedure, you take your cups out of the mount. That gets dumped into disinfection. So it never touches the tray. None of the instruments on the tray ever touch what was in the mouth. We want to create a barrier between what contacts the mouth and what contacts all the other parts of our treatment.
Okay.
Okay, so this is called no hands in the mouth system. That's because you can train people to utilize dental gloves, and you can use dental gloves. But even if you do, or if you don't, you still don't put your hands in the mouth. Doesn't matter that you wear gloves. And a lot of times you have to wear gloves because you will not be understood and you'll be criticized for not doing so.
Yeah.
But because in the real world, when I go to different places, like in the Central Congo, Democratic Republic Congo, for example, I train people. I go back and they're working and they don't have gloves.
Yeah.
They ran out, but they keep doing it anyway. They keep doing the dentistry anyway. So let's learn how to do it safely without the gloves, so when they run out of gloves, it's still going to be safe. That's the principle.
Okay. Thank you.
Okay? So no hands in the mouth, 2-cup system, and the other element, of course, is replication. So if it's economical and there's no expense and it's safe, then it's easy to replicate. So when you go somewhere, it's not about you doing dentistry, it's about you getting alongside some nationals, working together, so when you leave that area, whether it's a village, whether you go to another country, when you leave your tools and they can continue.
Okay.
Thank you. Well, I might as well be comprehensive here. I might as well cover all the bases. So before I just talk about the cleaning tool and what that does, I just have to say this. There's a few other things that are involved, okay? There's this thing, I'll have that light please, and the mask and the gloves. Just go over these things very quickly. All right, and the gloves please. We use, as I said, the no hands in the mouth system. That's why we have the red ties. Our hands never go in the mouth. Yet, in very many contexts, it is very appropriate and necessary that we do wear gloves. All right? And that's because most of the world won't understand. Most people won't understand that we are actually not getting our hands in the mouth, that we wash our hands every time between patients. Our hands never get contaminated. Our hands are always on the other side of the red line. So, and that's why we have that. So if I'm going to wear gloves most of the time, or all the time, then why bother with the red barrier system? The reason is this. I trained people in remote areas of the world, and on one of my trips going to the Democratic Republic of Congo, out in a very, very remote area, I was noticing that the people that our team had trained many years prior were doing dentistry and they didn't have any gloves. Yet they were still doing dentistry. And these folks were actually doing extractions, serious dentistry. And they weren't wearing gloves. And yet they would not do the treatment because no one else was there and the people needed the care. So that's where the idea came from, the no hands in the mouth system. Because even though we wear gloves in most contexts because we could be criticized for not wearing them, all right, to cover our bases, we use this system. We never get these gloves contaminated, so they actually never do get contaminated. So even if you violate the glove rules and touch things you shouldn't touch, you're actually still safe. It's kind of a foolproof system when you think it through, okay? So we would wear gloves and of course wear a mask because like right now I have this cough and when I don't want to be contaminating my patient's face and mouth. So we wear a glove and also we wear a headlight in order to see better in the mouth, okay? And when you do put your headlight on, every single little thing I'm telling you is important, okay? Yeah, this particular light has 2 settings. So when I do an exam, I like the brighter setting. And if you put it in the middle of your hand, make sure the light beam is placed in the right position so that when you look in the mouth, you don't have to use your neck muscles to adjust, because your neck muscles will get sore very quickly. So the first thing then, before you start any patient care or exam or anything, is you put the goggles on the patient's face. And you do so very gently. This is a mannequin, not designed for this. Okay, we're good. So we use only goggles. It's a requirement of our program because sometimes the goggles have a strap. They're not like safety glasses. They will not come off and they will stay there and they're protected all the way around. So, and plus when we use we have one sharp instrument in particular we call a cleaner. It's made out of a pin and I'll show you how that's done shortly. So we always bring our tools from the lower part of the patient up here. We don't actually cross the eyes. It's possible at some point the patient may have taken their glasses off, you may have not noticed, and you drop a sharp instrument in their eyes, it's called damage. You could drop the fluoride varnish brush on there and damage the eye because of the fluoride varnish. You could drop silver nitrate, which is very serious, on the eye. So you have several ways in which you could seriously damage the eye. So we don't take any risk whatsoever. We don't take any chances. We always wear goggles. Routinely, every patient. So this is why we can stand behind our training protocol as being a safe program. We use the no hands in the mouth system. We never get our hands contaminated, so we don't. So the tray stays clean, stays infection free at all times. If there's ever any doubt, we throw it in the bleach overnight, bleach water solution overnight. Okay, so now
we're getting that blackout. See that? Do you see?
So it means he's not cleaning his teeth?
No, he needs to brush his teeth a lot better. And that, yeah, it's all that sugar that he drinks that has right before he goes to sleep. Come on, buddy. There you go. That's it.
I'm down.
That's it.
Stubborn.
That's it.
Slowly.
Keep it up. Keep it up. Come on. We ain't done yet. You're doing good. You're doing real good. Keep it up. Keep going, come on.
Is it 20 seconds?
Yeah, I know, but my watch hasn't gone yet. I got a slow watch.